Hi, I'm Mary Bird with Beyond the Crown Veterinary Education. I want to talk with you today about hand instruments and probably the proper use to use our different hand instruments in the oral cavity. The number one that we like to use most frequently is actually our scaler. A scaler will actually have two very sharp sides and a sharp tip. Now this is only to be used above the gum line. We should always use this with a modified pen grasp, and actually we just have our little pinky extended, and I'm going to go ahead and start at the gingival margin and pull towards the crown of the tooth. We engage it and pull the calculus off coming towards the crown. We don't want to go back and forth and scrape, but just one, engage, pull. Again, this is a sharp tip, so we don't want to use the scaler below the gum line. The other instruments we'll use quite frequently are actually our curettes, and there's two different curettes. One of which is a universal curette, which has two sharp sides and a blunt tip. We also have the Gracie, which has one sharp side and a blunt tip. These are designed to go below the gum line. So when we use one of these instruments, we're going to go ahead and hold it with a modified pen technique. I'm going to go ahead and hold it flat against the gingival tissue, get up underneath the tissue, increase my angle to about 30 degrees and pull out. I want to go in, engage my cutting edge, and pull out with one full move to remove any calculus that's left below the gum line. Another instrument that I absolutely can't even imagine doing a dental procedure without is a Minnesota retractor. I really like this instrument. It can hold back the cheeks out of the way, but what I really like it to be used for is if your doctor's doing an extraction, I can go ahead and retract tissue out of the way for the doctor, and they don't have to use their periosteal elevator and risk getting it all damaged with their burrs. So Minnesota retractor is a must in my book to have in your dental operatory.